Good morning. I am Annette Wineza from the University of Rwanda. I am co-chair of the next sessions about precision medicine educations. So for this next session, the key speaker will discuss about the initiative to introduce education training in genomic medicine, especially in low-income countries. So the different initiatives were introduced to ensure that trainees are well prepared to deliver genomics medicine in patients with uploading the highest standard of care and ethical practice. So the next, I am also co-chairing this session with Richard Haspel from the NIH. And the first speaker is Professor Dhavendra Kumar from the University of Queen Mary University of London in the UK. Professor Dhavendra is highly acclaimed clinician in clinical genetics and genomics with contribution to application of novel genomics principle and technology in genomics precision medicines. He's the author of the Genomic Medicine Skills and Competency and part of the large series Genomic and Precision Medicine in Clinical Practice. So welcome, Professor Dhavendra, for your presentations called Skills and Competencies for Delivering the Genomic Medicine and Healthcare.
Thank you. Good morning. It's a real pleasure to be here in Geneva. I'm grateful to organizers of this splendid conference, Vajira and Mark, and the past president, the founding president, Professor Bruce Korf. So the topic of this session is, of course, the most important, that is education and training. And we need to have the skilled workforce to organize and deliver this service at different levels. So I'm going to cover a few aspects of my own experience in this field. Let me acknowledge my several people who have contributed to my books. As you can see from all these books focus on different aspects of genomic education, training, and different ways. For example, the most important, the most recent one, as you can see, the skills and competencies in genomic medicine, in which Professor Bruce Korf and Michelle Bishop, who are here in the audience, they contributed. And then we have also, we are almost completing the population and society book as well. So see, the point I'm trying to make that we have focused at as best as possible and the important aspect of education, training, achieving the skills and competencies required. For any job to be done properly, professionally, and satisfactorily, we need the knowledge base. We need to have the required skills, and we have to keep on becoming competent as we progress. So today, a young doctor would require, young doctor has the knowledge, requires training, and then become competent as the doctor progresses through internship, residency, and eventually specialist or a family practitioner. So if you look at what we have achieved in the last 10, 15 years, I'm a clinical geneticist. I practiced clinical genetics for many years. When we came to the point of genomic medicine, then we realized we have to really move out of our small area of practice, the clinical genetics clinic. And we developed genomic and precision medicine team in the large hospital setting. As you can see from this slide, so apart from medical geneticists, we needed medical specialists, we needed specialist nurses, we needed a genetic counselor, we needed a research and academic wing, we needed lab scientists, and also we needed patient support groups. So that made the team as such. So you can imagine every aspect of the team and the component of this team would require knowledge, skills, and competencies. So if you go much deeper into that, if the medical clinical skills at different levels are required, and then communication, counseling, and ethical issues are paramount, then what is common is how to use a database, not only for using it, but also how to develop the data using the phenotype, genotype information that will be generated as we go to labs and get more information back to us. And then in the background, what is happening in the basic genetics and genomics area. So if you look at the breakdown of number of years required for training, and that's where I think yesterday Dr. Tong from Malaysia also pointed out, it's very expensive to train a super specialist like expert in genomic medicine. You're talking about minimum 12 years, maybe 15 years actually. And then by the time the doctor is trained as a pediatrician or obstetrician or a surgeon, he or she has already spent 10 years, 8 years, 10 years, and undergraduate, as we know, minimum 5 years. So it is a very expensive, consuming thing. We have to now tailor-made, we have to move out a little bit outside the training model for genomic medicine. Now, if you look at this, is a slide I copied from Michelle Bishop. She wrote a chapter in my book, and she has very rightly broken down and the pre-registration, post-registration, and the workplace and breakdown of the different levels of skills and training which are required for what is called the continuum of genomic education. And that's, we have to remember that when we are training a nurse, we are training a doctor, we are training anybody else in the profession who is going to be part of the genomic medicine team. So pre-registration, as the name indicates, post-registration, like we have for doctors' internship and housemanship, and the workplace when the doctor comes or the nurse comes to work in the team. So it is a continuous process. We're never going to stop at one point. So that the continuation of that will certainly make the professional competent. And if you look at each step, we have the behavior change wheel framework, which is a very interesting article by McLaren and Frontier Genomics. I think I would recommend reading this one. It breaks down how the behavior will change at different stages. And Catherine Calazon from NIH, she is the founding president of the Global Genomic Nursing Association, and she has beautifully laid down from pre-conception, prenatal, and so on and so forth, right up to the bereavement counseling aspect in genomics, because people dying of rare diseases or sudden cardiac death, all those things. And then this is a beautiful slide from my friends in Melbourne, Clara Goff, and other people who have developed this education model for non-genetic practitioners. It is very important. We are going to work, we are going to interact at different levels, many non-genetic people who have got no idea about genetics, who have got no idea about genomics, but they are expecting, and they are sending you patients, they are sending you samples every day. Already doctor is taking buccal swab and sending it to the lab without much on the phenotype written on the request card. And then we have relied heavily on digital aspect of learning because of COVID. Now we are coming out, we need to have a balance of digital versus physical learning. And it coming to the achievement made by countries like China, a beautiful example how they have trained almost 500 genetic counselors in one part of China. Clearly, the other part of China is not covered yet in this presentation, in this publication. Myself, I've been involved very actively in the Indian subcontinent with the help of my colleague Bajira in Colombo, Sri Lanka. As you can see, the whole India we have covered, and everywhere we go there, we have been there, we have generated interest, not only among doctors, but also the community and the society. And there is a tremendous response. I mean, as you know, India has the largest number of private commercial labs, which is another challenge because of the cost, because of the data and all those things. So it is a really, this alliance is working in that respect. As you can see, India has also got different levels of training program, from very basic level MBBS elective right up to very high level. And this is very important for a diverse country like India because of the cost, because of the training opportunities, because of the expectations. So what I'm trying to point out, one should not be really limited to one or two dogmatic or established training program. We have to be very flexible to create the workforce with the required skills and competencies. So, and then, fortunately, I'm chairing the Hugo Education Committee, which has got all very important agenda in hand, and we are making progress, especially for low and middle income countries. And I'm always reminding myself what Sir William Osler said, that education, teaching, studying is always continuous. Once you stop, that means you are finished. So I think with that message, I'll say thank you very much.
Thank you very much. We will have the questions after the sessions. Yeah. So let me invite, and thank you very much for your good presentations. And let me introduce the next speaker, who is Professor Nirmala Sirisena. She's a professor in medical genetics at the Department of Anatomy, Genetics and Biochemical Informatics, Faculty of Medicine, University of Colombo in Sri Lanka. Her special interests are clinical genetics, cancer genetics, and genomics, and also genomic education. Dr. Nirmala is going to talk about education and training program developed to implement genomic medicine in South Asia context. You are welcome.
Good morning, everybody. Thank you for this opportunity to share with you my experiences from Colombo, Sri Lanka. So for the purpose of this discussion, I will be focusing on genomic educational initiatives developed from Sri Lanka, because that is where I'm based. Because as you know, South Asia is a vast region with a lot of genetic diversity and so many variations. So I will talk about the initiatives from Sri Lanka and beyond. So Sri Lanka is a small country located in the Indian Ocean, and it's an LMIC, has a population of about 22 million, and various ethnic groups are there, shown on the slide. It has a very high literacy rate, and education in the public sector is free from the primary to the tertiary levels. And we have about 12 universities with medical faculties and one postgraduate institute that coordinates all the postgraduate medical training in the country. The healthcare in the public sector is free, and recently we have noticed that there has been a drastic decline in the infant and neonatal mortality, but birth defects remain a major source of morbidity, and almost 30 to 40% of neonatal mortalities are attributed to birth defects and genetic disorders. So I'll just briefly give you an overview of the current status of genetics education services in Sri Lanka. So this is the Faculty of Medicine in the University of Colombo, where I'm based along with Professor Vajiraju Sarnayaka. And it was established in 1870, and it's the leader in providing medical education in the country. Then we have the Postgraduate Institute of Medicine, which is also part of the University of Colombo and established in 1976. And this coordinates all the postgraduate training in Sri Lanka. So this is the Human Genetics Unit of the Faculty of Medicine, University of Colombo, where we are based at the moment. And as you can see on the photo there, you can see Professor Vajiraju Sarnayaka during the early years of his career when he was training under the founder director of the Human Genetics Unit, Professor Jayasekara, and I was privileged to be trained by both of them. So those are the founding fathers of genetics and genomics in Sri Lanka. So it serves as a national referral center for all genomic services in Sri Lanka. And over the past 4 decades, it has risen to the status of a Center of Excellence in Clinical Genetics and Genomics, and we are dedicated to providing genetic counseling, testing, as well as promoting genomics education and research. So we have published our experiences and challenges in implementing genomic medicine in a resource-constrained setting through several publications and book chapters. So I will discuss the initiatives under three broad categories. So we have the university-level undergraduate educational initiatives, then the postgraduate educational initiatives, and the continuing professional development programs. So looking at the undergraduate education, the medical genetics is part of the medical curriculum in the faculties, the medical faculties. So it's taught to the first-year medical students, and that is the main period during which they get the input, and then varying inputs later on. And it's good to know that the BSc Physiotherapy program conducted by the university is the only allied health sciences program that provides medical genetics training in its curriculum. Then the human genetics unit provides a lot of postgraduate courses for both the medical and the molecular science graduates. So we have master's courses like the MSc in molecular pathology, which was formerly the MSc in genetics diagnostics, and we have the MSc in clinical genetics and PhD opportunities in medical genetics and genomics. And important to note that we had graduates from Nepal, the first two clinical geneticists in Nepal, and the first two molecular diagnostic scientists from Nepal were trained by us, and they were graduates of these courses. And now, as you can see on the slide, they have gone back to their country and implemented what they have been trained on, and they have established a genetics lab at the National Academy of Medical Sciences at the B Hospital in Kathmandu. So those are the two postgraduates from our course who have gone back and implemented genomic services in Nepal. Then looking at the other postgraduate input, the staff of HGU provide a lot of medical genetics input to the specialty courses conducted by the PGIM. And recently, the board certification program was implemented in clinical genetics, and that is because of the need for setting up clinical genetic services in the country. So this was part of the plan, National Health Strategic Plan of the Ministry of Health, and this was introduced in 2020. And we have 5 trainees at the moment who are undergoing the training, and 4 pediatricians and 1 physician, and I think 2 of the pediatricians are here in the audience with us. So that is the new initiatives that have happened recently. Then in addition to that, we have catered for the non-geneticist medical professionals by implementing continuing professional development programs. And one of them is the training program in clinical genetics. And also we conduct workshops and symposia on integrating genomic medicine into their clinical practice. So in 2021, we introduced the training program in clinical genetics, and that is with a view to training the non-geneticist medical professionals in the core competencies in genetics and genomics and how they can integrate it into their clinical practice. So I have a small video clip of the program, and we'll just look at it. The audio. Do we have the audio on this?
And conducted twice a year by a team of experts in genetics and genomic medicine.
Can I go back and start? Sorry.
Welcome to the training program in clinical genetics offered by the Department of Anatomy, Genetics and Biomedical Informatics at the Faculty of Medicine, University of Colombo. This part-time, 3-month hybrid course consists of online lectures with on-site genetic clinic-based sessions and laboratory demonstrations, and conducted twice a year by a team of experts in genetics and genomic medicine. The course is divided into 3 modules: basic cytogenetics and molecular genetics, genetic diagnostics and ethical issues, genomic medicine and genetic counseling. All medical graduates who wish to upgrade their knowledge on understanding the effects of chromosomal abnormalities and genetic variations on human health and disease, analyzing pedigrees and assess risk of inherited diseases, using clinical evaluation and genetic testing to diagnose genetic disorders, selecting appropriate genetic diagnostic tests, interpreting results of genetic tests, providing accurate genetic information and advice to patients, their families and the community, are welcome. A certificate of completion is awarded to trainees who are successful at the final assessment. Very positive and encouraging feedback was received from the past trainees. They were very appreciative of the opportunity given them to receive the training, as it provided them a valuable opportunity to integrate genetics and genomics into their day-to-day clinical practice for improved patient care and management.
Okay, so that was just a brief promotional video that we developed. So in addition to the CPD programs, we conduct training workshops for the medical professionals. So one of them is the international workshop and symposium that we had on integrating genetics into the medical curriculum, which was held in Colombo some time back in collaboration with the International Genetics Education Network. And we had several delegates from most of the neighboring South Asian countries participating at this conference. Another one was, sorry.
Welcome to the
So can we go back? Okay, sorry about that. So another one that we had was a pre-conference workshop on development of targeted genomic education. This was held in collaboration with the GC4GE, that's Professor Dhavendra Kumar was there with us, and he spearheaded this. And this was held as a pre-congress workshop on the first day of the International Conference on Birth Defects and Disabilities in the Developing World. That was in 2020. And we had a lot of delegates from the neighboring South Asian and Southeast Asian countries coming together and deliberating on these matters. Then in addition to those, we conduct regularly one-day pre-congress workshops on integrating genetics and genomics into the clinical practice, mainly targeted at the non-geneticist medical professionals. And usually we do this in collaboration with the medical associations in the country, especially the Sri Lanka Medical Association. So we have had quite a few already. And another international collaboration we had was with the University of Montpellier in France, development of the Human Genomics e-learning platform project. So this was done by the University of Montpellier in collaboration with WHO, and we were invited to collaborate on this. And also we provided and developed some of the learning contents that are there on the platform. So last but not the least, it's important to remember the community also, the public engagement. So we normally continually update them and inform them about the services which are available, the genetic facility services, and how they can avail themselves. So we, through the media, newspapers, and so on, we normally inform them of the services that are available because the community is important to us. So in summary, for successful integration of implementation of these strategies, it's good to have a core curriculum or with the core competencies in genomic medicine targeted at the different groups. So you have the undergraduates, then we have the medical graduates, the allied health science graduates, and so on, and also the postgraduates with the subspecialty core modules to cater for their specific needs. And also to streamline the genomics education for the practicing healthcare professionals through CPD programs, which could cater for their special subspecialty areas. And also not to forget the paramedical and the allied health science professionals, because they are part of the healthcare team and they need to be educated and trained on these basic concepts in genetics also. And one of the important things I think I would like to highlight here is the need for partnership with global providers of genomic education. Now, I know there are quite a lot of partners who are here in attendance, so they already have these programs up and running. So it's good to share knowledge and help build capacity, especially in the LMICs through exchange programs or through joint trainings and so on, so that we can make use of the facilities that and the resources that are already available. Okay, so in conclusion, I would say Sri Lanka has made some significant strides in integrating genetics and genomics into the educational and healthcare systems. This is just the beginning. I know there's a lot more to be done, and we have a long way to go. And this is just the initial step. So there's need for enhanced infrastructure, collaboration, development of human resources and manpower, and getting the community involved and having targeted approaches to make sure that this is successful in the long term. And we believe that with the right investments, Sri Lanka will be able to position itself as a hub for genetics and genomics, as a provider of genetics and genomics in the South Asian region in the future. Thank you for your attention.
So thank you, Professor Nirmala, for this interesting topic about introducing genomic education in African and Asian context. So the next speaker is Professor Richard Haspel from the NIH. He's a professor of pathology at Beth Israel the Connex Medical Center and Harvard Medical School. He's the co-chair of the NGRA, Inter-Society Coordinating Community for Healthcare Provider Education in Genomics. He has developed, with NIH funding, genomic curricula for healthcare professionals. Welcome, Professor.
Hi, everybody. Good morning. I guess I use this. I'll just go forward. I'll get the slides. There we go. All right. So hi, everybody. So yeah, I'm a pathologist in Boston, but my academic interest is medical education. And I'm a guest researcher at the NHGRI, where I work with them on sort of educational initiatives. So what I'm hoping to do today, and if you want to pull up genome.gov, we're going to do a little bit of a guided tour of some of the resources that NHGRI has for education. And these include ones for healthcare providers, healthcare professionals, as well as more general resources for, the public and stuff like that. And also, because we're an international group, a little bit about some of the international resources for grants and things like that people outside the US can take advantage of. So if you happen to be on the website, or you can do your phone on genome.gov, on genome.gov, if you're on a computer, it's at the top, there's this menu, or if you click the little menu thing on your phone, there are these different topic areas you can select. And one of them is about health. And what will come up there are three different areas. There's healthcare provider genomics education resources. There's this group ISCC PEG, which I'm the co-chair of, one of the co-chairs. And then there's also a family health history for healthcare professionals resources. I'm going to focus more on the first two. So let's talk about ISCC PEG, which is a very long name. But what it basically is a group of people coming together to figure out ways to improve education in genomics. And there are two sort of core principles with this. One is education, just like any other area of medicine, is something that can have evidence-based practices, and you can even do research to study those best practices. It's not just a few people in a room who haven't had necessarily any training in education, just coming up with a curriculum. There's really an expertise there. And the second is one of my favorite descriptions of a committee is just like teamwork, but without the work, where people just come together and like to talk. So one of the goals of ISCC PEG is actually to create resources. So there's free membership. Anyone can join pretty much. It's organizations who are healthcare professionals. Organizations, institutions have representatives, industry, but also individuals can join. It's all volunteer. There are conference calls we have. There are different project groups that come together to develop resources. And we have an annual meeting that's a hybrid. And the goal is to have the stakeholders come together to improve genomic literacy and enhance the practice of genomic medicine. And really, it's a model of interdisciplinary collaboration. We have doctors, nurses, genetic counselors, you name it, pharmacists, pharmacologists, everybody coming together to really discuss how to make better resources and actually create those resources. And here are some examples. These are our 8 project groups, which are focusing, and again, not to just together to talk, but actually that's why we call them project groups, to actually create things. And you can see we have in a variety of different areas in genomics. And this is just the images of a lot of the organizations that are involved in ISCC PEG. You can see it's all over the place, which is the goal. And we currently have about 280 members from 58 organizations, have representatives. We have representatives from different institutes, 7 companies, and 138 individuals. And new members are welcome. We already have international members, but other people are welcome. And you'll see, you can go to the website, which I'll show, and you can, fill out an application to join. So a little bit more about some of the resources ISCC PEG has created. So we've created a couple of frequently asked questions documents to help different groups like nurses or physicians who have to deal with direct-to-consumer testing. And again, these were put together by panels of experts from different disciplines, not just one discipline, to create these resources. We have our pharmacogenomics working group created a series of learning modules to help teach pharmacogenomics. There's a group, Project Inclusive Genetics, which is talking about cultural competency in genetics, and they have a learning module. There were these series of, basically, the National Cancer Institute provided funding to create team-based learning workshops related to genomics. So literally getting people together to sit at tables and use online genomics tools to really learn hands-on how to do this. And then the NHGRI, and working through ISCC PEG, created modules outside of cancer. And they're literally plug and play. Whatever specialty you want, it lists questions and websites, and you can basically plug in your specialty. And using these modules, there's been workshops with the American Heart Association, the American Academy of Neurology, pediatric academic societies. So it's a way, again, just like ISCC PEG, all these groups can create real hands-on learning modules. And then a group from Texas has been working on cardiovascular modules. And also, anyone can join this, even if you're not a member of ISCC PEG. It's a listserv where people can put educational resources and meetings and things like that, and you'll just come into your inbox. So that's another resource that ISCC PEG created. And then, again, under the Health Professionals tab of NHGRI, we have healthcare provider genomics resources, and there's a variety here as well. One really neat thing is called Genome Ed. You can search for it's basically a clearinghouse of peer-reviewed educational resources. And there's a committee that looks at these resources and says that, people submit them, and this committee decides, which is related to ISCC PEG, are they worth putting in Genome Ed? And you can submit your resource, and you can search for it, and there are about 129 resources in a variety of areas. There are also discipline-specific genomics competencies available. There's an excellent website called G3C, which is a series of modules and simulations, and they're amazing. They have actors. You can sort of ask them questions. They have patient actors, physician, and they're little videos, and you can really interact and learn about different areas. So it's a great learning tool. There's a tool for introducing new competencies in genomics. And again, this is another way, besides the ISCC PEG section of the NHGRI website, but a lot of the ISCC PEG resources are also on this portion of the website. Another thing you'll find on the health professionals page of NHGRI, going back, starting a few years ago, we created a healthcare professionals genomics education week, which is again a very sort of social media based and webinar based way to learn about genomics, and different organizations support webinars and sort of Twitter discussions and things like that. And it's been since 2021, and there's a there's the web page, but then also there's a toolkit for the different partners who want to create their own social media aspect of this week. And it's usually around June. And just as you can see, when one of the first ones we did, there were over 4 million impressions through Twitter. And compared to previous NHGRI sort of weeks or days, it was really impressive, the level of interest we have. And we're hoping to do it again this coming year in June. Okay, another place to click. So we previously at the top menu in genome.gov, we clicked on About Health. If you click on About Genomics, you'll get to educational resources. And then we have a bunch of things. These are more geared towards, some of them are for, less healthcare professionals, but college or high school or things like that. And then, and community outreach. And then there's also the health professional stuff you can access. And about international opportunities. This, you go to a different web page. This is the Fogarty International Center. And you'll see a thing at the top where there's a menu. If you go to grants, these are grants that people outside the US can apply for. And some of them are training and educational grants. So, so take a look if you're interested. And if you go where it says Genomic Health Resources, there are things like e-learning resources for global health researchers and things like that. And you can go, if you click on subscribe, you'll basically be able to get their newsletter. I highly recommend getting the newsletters for NHGRI and the Fogarty International Center, because it'll tell you about things they have going on. So that was just a quick guided tour of everything. I hope, there's a lot of educational resources on NHGRI. Take some time to explore them. If you're interested in ISCC PEG, obviously you can ask me questions, but also, and it's individuals, but also organizations. It's great having reps from different organizations, because then when we create something, we can spread it out. And also it brings in different expertise from different areas. And then also check out the Fogarty International Center as well, because there's a lot of resources there, both educate and especially around education and training. And just some thanks, obviously to G2MC for allowing me to speak, ISCC PEG. And Larry Brody, Donna Messersmith, and Beth Tuck are people at NHGRI I work closely with. And Donna Messersmith is the co-chair of the NHGRI co-chair I work with for ISCC PEG. And then, because I hope these slides will be available for everyone, just some QR. I learned how to make QR codes, so I went a little crazy. But anyway, feel free to sign up, and if anyone has any questions. But thanks for the opportunity.
So thank you, Professor Richard, for these free courses available to everyone. And the next speaker is Dr. Victoria Nembaware from the University of Cape Town in South Africa. She's a senior lecturer at the University of Cape Town and project manager for the Sickle Cell Africa Data Coordinator Center. She's the current secretary of the African Society of Human Genetics and was the first coordinator of the African Genomic Medicine Training Initiative and MGen Africa, and the first training coordinator for the H3 Africa Consortium. She has a PhD in bioinformatics with research experience in public health. Thank you very much and welcome, Dr. Victoria.
Great, thank you. Thank you for having me, and I'm really, it's a big privilege for me to be standing here presenting work from various networks in South Africa. So as you can see from my title, I've actually added an S because I will just talk about skills development for early and mid-career investigators in the African networks, because a lot of the times we work horizontally and vertically. We don't always work in isolation. Just to acknowledge, the different networks that have contributed to the talk that I'm going to give. As indicated, I'm part of the African Society of Human Genetics. I've worked extensively with H3 Bionet and H3 Africa, and we've been supported by various organizations, including the Wellcome Connecting Science and even G2MC. So I'll just briefly discuss what our training focuses on in terms of skills development, how we can increase diversity. We've been battling with that question, and how, the question is our training making any impact, and is our training Ubuntu inspired? So basically, the training that we give, the skills development training, focuses on research, skills, because here we are focusing on how we are developing research or investigators. We also look at implementation research to actually make sure that the genomic medicine initiatives that are being conducted can be implemented. We also look at ethical, legal, and social implications. And this is focusing on community engagement, ethical issues, and so on. And another aspect that we think is really important is professional development skills. How does one write a grant proposal? How does one develop a manuscript? How does one develop a systematic review article? Because as much as one can have the genomic expertise, it's very important to make sure to solidify that with skills that can make them really competent and highly impactful research investigators. Okay. I think this is okay. So how do we increase diversity? So when you look at the pyramid, where senior investigators who have called PI on this top pyramid, we start off with high school learners, with undergrads, with postgrads, and we are focusing our training on mid-career and postgraduate researchers, which are early career. But in fact, we need to look ahead, 10 years from now, 5 years from now, as indicated in some of the talks yesterday. And one way of doing this is making sure that we get our investigators early on in high school so that we can actually promote genomics, uptake of genomics careers and interest in genomics careers earlier on in the high school learners. So how did we go about it? We created a very accessible platform, which is accessible via the web and also via mobile phone, which has competitions, quizzes, makes opportunities available to the high school learners, live chats, knowledge. And this knowledge, we actually use resources even from the NIGR website, any publicly available systems. And in combination to this mobile application, we also make genomics really fun in person. So once a year, we host an annual quiz competition. Initially, it started off with one district in Cape Town, and then it ballooned up to the Western Cape province. We're now aiming at actually going national, but there's been a lot of interest in expanding this program to other countries across Africa. So depending on availability of funding, I think this is a program that could be scaled up. In addition, for the high school learners, it's not only to increase their knowledge in genomics through these quiz competitions and so on, but it's also to provide genomic career options in an authentic and relatable manner. And the real key thing about this is that a lot of high school learners who come from disadvantaged backgrounds do not have a role model in their community who's ever studied genomics. So sometimes, or in most instances, one studies a career after being inspired by someone or being exposed to it. So through this MGen Africa project, we are hoping that we can provide some career options by actually spotlighting researchers who come from those same communities and giving like a little bit background of their work and how they got to be where they are. Another option of increasing investigators in the genomics area is training healthcare professionals who otherwise were not interested in research to actually be piped into the research career. And I just wanted to highlight a project that we've been working on, which is the African Genomic Medicine Training Initiative, where we train healthcare workers in just basics of genomics, ethical, legal, social implications, clinical applications, and also research. We expose them to research concepts, and we encourage them in their classrooms, because this is done through distributed classrooms. We encourage them through their classrooms to actually produce publishable articles based on the research module that they would have taken. Initially, we started off with nurses. We've now expanded to doctors and lab scientists. We had 11 countries participating with 19 classrooms. And this year, we had actually 12 countries with 21 countries and over 840 participants participating. And is our training making an impact? One of the quick questions is, yes, we can get feedback, from the participants, which we do, but we also actually assess proper tangible outcomes which the learners have to do. For example, articles from the African Genomic training initiatives in the form of review articles which are published from the class participants. And for a recent grant application development workshop that we conducted, we are now going to provide seed funding to participants who attended the workshop to assess whether they actually learned anything from our training in a very practical way. Is our training Ubuntu inspired? Ubuntu is an African philosophy which really is about giving and sharing whatever you have. Based on this ethos, we thought it was important for us to share the knowledge that we've acquired in African genomics with the global populations. And on the screen, you can see a Trends in Genetics paper we've just published, where we are providing data science workshops in African genomics, and this is being led by African researchers. You can go to the QR code if you're interested, or if you've got a graduate school class that's interested in learning African genomics, and we can discuss further. And we're just hoping that with this increase of knowledge, or our willingness to share the knowledge and train others in African genomics globally, we're hoping that African genomics will help change worldviews. I hope you can actually see that in this new worldview, Africa is at the center and at the top of the map. Thank you.
Thank you very much, Dr. Victoria, for this presentation about these initiatives, which has a great impact in the African continent. So the next speaker is Dr. Michelle Bishop. She's an Associate Director, Learning and Training at the Wellcome Connecting Science, where she leads a team of scientists, educationalists, and even organizer. She has worked in the field of genetics and genomics for about 70 years, and she's a trained genetic counselor and hold a PhD in genetic education. So you are welcome.
Thank you, everyone, for this opportunity to present some of the work from Wellcome Connecting Science. I've been privileged to be part of Wellcome Connecting Science now for just 18 months, having moved from the NHS and Health Education England. So what I want to talk to you today is about some of the work that we've been doing at Wellcome Connecting Science, in particular around in the Global South. Our mission at Wellcome Connecting Science is to enable everyone to explore genomic science and its impact on research, health and society. While we're based in the UK, we very much collaborate with diverse communities to transform engagement with genomics. Our outputs and our activities impact policy, practice and careers. And through this, we're hoping to establish the Wellcome Campus as a recognised centre of excellence for both learning and engagement in genomics. We are funded by the Wellcome Trust, and we're part of the same family of organisation as the Wellcome Sanger Institute, which many of you will be familiar with. And we're based at the Wellcome Genome Campus, which is just south of Cambridge in the UK. There are two parts of Wellcome Connecting Science. There's engagement and society, which works with the public and communities, and my part of the program, which is learning and training, which works with professional audiences. Both of us draw on the cutting edge research that is conducted at the Sanger Institute. And as part of the learning and training program, what we do is democratise the research findings and tools. So all the information that's coming out from the research at the Sanger Institute, we then deliver education and training around that so it can be utilised by members across the globe. But we also respond to local and regional needs as well. And I'll go into what that means in a few slides later. So as part of learning and training, we deliver evidence-based learning and training programs for professional audiences who use genomics in their work. We define professional audiences at the moment as researchers, healthcare professionals, public health professionals, as well as the educators that are involved in educating healthcare professionals. We have 3 work streams to accelerate global research in genomics. So this is very much focused on discovery-based research, to develop global capacity, and to contribute to the implementation of genomic medicine. We engage with about 25,000 people each year globally, and we do this through 60 events or activities that we deliver each year. These include conferences which we hold on our campus for knowledge exchange, training courses which can be delivered either through the Welcome at the Genome campus or in our global hubs in Latin America, Africa and Asia. And we also deliver online learning as well, and we do this through the FutureLearn platform through massive open online courses. While we do have a small team that works at the Genome campus, we couldn't do any of the work that we do without our collaborators, and we work with about 500 of these each year who are our subject matter experts, and some of them are actually in the room today who have worked on many of our courses. All of our events can be categorised under one of 3 very broad content areas. So human health, and we consider this from discovery research right through to implementation, human-environment interaction, and emerging genomic tools and technologies. In this last category, this is where events take very much a species-agnostic approach so that people will come along, learn the techniques and tools, and can then apply them in various different settings. In terms of our training, we take a tiered approach to the training. And when we're looking at training needs, we identify what would be the most appropriate method for training. Starting at the bottom with foundation knowledge and skills, this is where we use our online courses because we can access a large number of people at any one time. And if you're thinking about how this works, we think about it as that more superficial level, that foundation level of knowledge, but covering a very broad area. But this is the information that is needed to then build on the knowledge and skills going forward. The next level up is where we take a slice of that knowledge and go much deeper into the learning. And we use a methodology here called distributed classrooms, which Vicky just touched on, which I'll go into more detail in another slide. And then finally, our residential courses, which range from 5 days to 2 weeks, which cover both breadth and depth of learning. While we're based in the UK, our work is very much globally focused, and we respond to regional needs. So when we're working in the Global South, our work is very much driven by the Global South. It is the Global South's priorities that we work to, not to our own agenda. And we do this through maximising the value of investment in the country or responding to regional health priorities. And why people work with us is that we're not bound by any geographical location or any organisational restraints. We can basically work anywhere and with everyone. That allows us to respond to existing challenges that perhaps other organisations or institutes can't. Another reason why a lot of people like to work with us is that we do heavily subsidise the costs for our global program. We really try and minimise any barriers that might be in place for people accessing education and training. And we very much work on a model of co-development and co-delivery. We are working with organisations rather than helicoptering in, training and then helicoptering out. So I'm just going to cover 2 case studies to just demonstrate what this program looks like. The first is around increasing capacity using the example of bioinformatics. And I've put up there 3 examples of training courses that we've done, starting with online learning, the distributed classrooms, and then in-person training. The online learning, you can see we can reach large numbers across the globe. Our distributed classrooms, so this is a format where we have individual classrooms that are doing in-person learning, but doing it together, so a synchronous learning event that is coordinated through a virtual hub. And this allows us to access a large number of learners who are getting the benefit of both in-person training as well as reaching large numbers of people. And then finally, you can see that one of our courses that is being held next month, or actually in a couple of months, in Latin America. This is more in-depth learning where we have a small number of learners, but we cover a lot and go into quite deep learning with them. Through this in-person learning, we can also see talent and leadership pipelines that we develop, where people start as participants on these training courses. They then come back in the next iteration as a course assistant. They then may go on to lead aspects of this learning and training, and then they take the skills that they've developed about education and training and often then develop their own education and training within their country. And then finally, thinking about leveraging investment, there's a lot of investment that is happening across the globe, either through domestic investment or through other organisations such as Wellcome, CZI or Gates Foundation. And we can use education and training to leverage this investment, so to get the most out of this investment. This can either be through bridging the gap. So we heard some examples yesterday where some courses are being developed, training courses that are being developed for, say, genetic counsellors or clinical geneticists, but it takes time for individuals to come out at the end of those training courses. We can come in and provide short format training to skill up a proportion of healthcare professionals to deliver the clinical needs that are required while we're waiting for those more sustainable educational methods to come to fruition. And we can also accelerate in region capacity. That photo up there is from a course that we delivered in Brazil in July around single-cell genomics. There's been a lot of investment from the Chan Zuckerberg initiative in single-cell genomics in the region. And we're aiming to educate and train over 100 scientists around single-cell genomics so they can take full advantage of the investment in their country. So in closing, while we are a UK-based company, we have a learning and training agenda that very much has a global focus. Our activity is driven by the Global South, and as I said, we do have this model of co-development and co-delivery. Our evaluation shows that what we do works. It not only improves practical skill development, but we can also accelerate knowledge sharing, development of networks and collaborations. And through this, we're building communities of practice so that we know that our impact lasts beyond a single event. And with that, I thank you and happy to take any questions during the panel discussion.
Okay. Thank you very much. You can remain seated, and I would like to welcome all previous presenters because this is the time of questions. Yeah.
Hello, this is Dr. Rupesh from Nepal. I have a question with Professor Dhavendra. So I need to know that what are the challenges have you faced so far during this educational development thing in the low middle income country? Like on the perspective of ethical ways, what things you have faced and what are the financial challenges there when you started in India doing the things for the education? Thank you.
Thank you. I think if I understand correctly, you're asking the resources.
Yeah, resources and ethical challenges, like what may be the ethical issues which may be faced by the while developing the genetic educations in that part of the world, and what are the financial limitations you have faced so far?
So far, we have only coordinated this program through large institutions and a few large hospitals. So we can say that it's a very a very selected, biased kind of approach. And so we have within the large hospital, large academic institution, we we approached head of the departments or leading academic people and principals and vice chancellors. They offered us a space and including hospitality. So in terms of resources, I think that's how we started. There were numerous challenges because we also had faculty traveling from UK, USA, and other parts, including Australia as well. So it was a huge challenge how to really tailor the faculty with a very different high level of background and coming to very low level of because we didn't know about what was their level in India, different places. It's a large country. So now with this alliance, now we are able to reach out with more, I think, to lower level of the secondary level of hospitals and the secondary level of private medical institutions. So you can say it's a very kind of pilot study, pilot program, and there's so far very little or very minimal kind of government or this thing input. And they have, however, occasionally provided us some support, but not a great deal of interest, not a great deal of enthusiasm. Having said so, one of the success story which I can share is when we approached the National Medical Commission, which is the medical registration body like the Medical Council of here in the UK, they agreed to have an elective program at the MBBS level, and we only had one session of that. So that is offered at the 7th semester of the MBBS. And again, that depends on the institution. I think in this case, only one institution we came forward and we have done that. And we plan to, I think, as I said in my slide, I strongly believe we start at a lower level. It will take some time, but it's most cost effective. To answer further your question, I mean, I'm not in favor, except for very few selected institutions, I'm not in favor of large number of trained clinical geneticists or specialist in genomic medicine clinicians. I want to integrate genetics and genomics at different levels. So when a pediatrician comes out, pediatrician has sufficient knowledge, and without going to the further training, sufficient knowledge of practice genetics and genomics and different areas. And we have made some success in the cardiology, and there is a group in India, and that is, I think that's the approach. We can certainly have high level of training program in certain parts of the country. I hope it answers your question.
Oh, thank you. I have two questions. One for Dr. Bishop and Dr. Victoria. So the first one is about, it's a great initiative coming out from Welcome Connecting Science and trying to reach all over the world. But as you may be aware, 75% of the world don't even speak English. And they need to understand what is going on. They need to also be included in everything you're talking about in genomic education. So what are the efforts coming out from Welcome Connecting Science to reach people all over the world that don't speak English? So how do you identify their need and how do you meet their need? So my second question goes to Vicky. So it's very exciting for the first time to see that initiative is coming from Africa, where you leave Africa to train people in the West. That is great, you know. Can you explain, how did you navigate to get to do that? And what can other people do? For example, I don't know a lot about what is going on in Brazil or what is going on in Pakistan. So what can those countries do also to bring maybe like Pakistan genomics to other populations, maybe to the West or to Africa? What can they learn from what you did?
Okay, I'll go first. You're right that all of our program at the moment, almost all of our program at the moment is delivered in English, and we do recognise that's a massive limitation of what we have. We do, through the engagement side, the other part of our program, we have done a lot of work in finding out the views of people in many different languages. So Anna Middleton, who heads up that program, was involved in a massive study that was coordinated under the GA4GH, where surveys were sent out in many different languages to try and capture the views of individuals who don't speak English. In terms of learning and training, that's a big part of the work that we're doing now, is to try and identify how we can deliver our training in other languages. We are actually running a course in Brazil on the introduction to bioinformatics later this month that will actually be run in Portuguese, and that's the first time that we're actually attempting that. Fortunately, I've got 2 members of my team who are fluent in Portuguese, but we don't have that for every other language. So we are exploring with different organisations and different platforms about how we can translate the information into other languages. So thank you for raising that. It is a really important issue that we need to address.
Yes, thank you, Shegun, for that question. The training that we did to provide African genomics training to participants or to a group of postgraduate students in Ireland was only made possible by the willingness of experts like yourself, Shegun, who were willing to train for free, like Michelle. So I think it's really important to identify people in the community that are passionate about training and sharing the work with others at no cost for now until we source more funding. So I think it's only made possible by the Ubuntu spirit that exists in the networks. And for areas like other countries that have got minority populations that might want to do similar aspects, we're very willing to share the model. And at the same time, I don't think it would be a bad idea to actually partner with them and see how we can create a 2-week-long minority populations, training workshop for other populations to come and learn about the minority genomics. Thank you.
Hello.
I don't know if that answers it, yeah.
So it's Enrique from the Canadian Institute of Health Research. I guess that question's partly actually addressed what I was going to ask, which was stem from Victoria, the point you made about the importance of having role models in various communities that are not often represented in like universities or in programs like we usually do. So my question was actually, what would be your lessons learned in terms of improving the inclusivity of our training initiatives, and especially looking at the social and the ethical aspects of the training that we are developing to make sure that we include all communities. Language is certainly another very important point, but was wondering if through your experiences, there are other things that you would be able to share on that as we develop training programs, and we don't necessarily want to address the same phenotype that we've historically been doing.
So if I understand, like, how to increase inclusivity, right? Yeah, so I'll just give one perspective. I think whenever we've taught about genomics, we try to include, I think it's important to include a discussion about how race is not a biological construct, and also to recognize diversity and things like that. I think it should be a component of almost every curriculum to talk about the importance of diversity and inclusion. We include, I mean, this is more US centric, but we include a paper that was in the New England Journal where there was a group of patients who self-identified as Black, and they were told they had a pathogenic variant for cardiomyopathy, and it was because they supposedly had a rare variant. But then 5 years later, when they researched the database, they found 15% of people with recent African genetic ancestry have that variant, and they had to send them letters basically saying, guess what? It wasn't pathogenic. So I think it's very important to include in any curriculum you have issues related to inclusivity using the literature, and also the importance of diversity in genomics. And also related, there's a ton of ethical issues just in general. I think you shouldn't avoid them. I think you need, obviously you could spend like a week on that, but to at least make people aware of these issues and talk about those things. And of course, the US has certain issues around race and things, but I think more broadly speaking, inclusion and diversity should be in pretty much almost any curriculum, especially health professional. So.
Can I just I think you're also talking about how to include diversity in people coming into the profession. Yeah. So we, as part of our program, we do a lot of work with school children, and I think it's really key to capture their imagination at that stage before they make decisions about what they're going to do. Sometimes they feel they can't do something because they don't see the role models that they have. So we do a lot of work about trying to find those role models, but also bringing in school children who perhaps are at schools that don't have the advantages that other schools may have, so that they can see what the campus looks like, meet people that are on there, see people that look like themselves working in these fields, so that they can then know that actually they can do that, and try and encourage that from an early stage. I think if you're trying to do that, you know, at university level, you may have missed the boat already because you haven't got people who are opting to do science in those areas. So we try and capture as early as possible. And I know that there are a lot of programs that are around the world that are trying to do that. And I think the more that we can all engage with that would be really good as well.
So thank you very much. We have a last question from online participant. It's addressed to Nirmala. I am a clinician coming from Vietnam. I want to begin a training course for clinician doctor. What should I begin with? The genetic topic? What are the minimum requirements if you want to start a training program in limited resources?
Yeah. Yes, I think you just start talking.
The thing is like, you have to start from somewhere. So like,
I think a little closer. No,
so the thing is, if you are initiating a training program, so initiating a training program in clinical genetics, of course, first of all, you need the human resources, because you have to have trained personnel who are, trained in genetics and genomics, and then you have to have also the lab facilities, the laboratory services, clinical services. So those are the starting points, because if you have not established a laboratory, genetics laboratory or a genetics clinic, and you don't have the trained personnel, then it's going to be difficult and challenging. So the first thing would be to sort of collaborate and see if there's a way of building the human resources manpower and the capacity, and then from there try to see what the needs of the population is where you are located, and probably you can do a needs assessment survey and see what are the needs, what is the level of knowledge that is required for the physicians, and then target the training program to cater for those needs. So that is something we did in our setup clinically.
So thank you very much. Maybe we are running out of time. I would like to thank you, the keynote speakers, for these interesting topics. And we are going to have the next session. Thank you very much.